Okay, so we're going to talk about multiple sclerosis now. Multiple sclerosis is a nerve disorder, and it's debilitating, or it can be debilitating. And when we think about multiple sclerosis, what happens is, as we know, we have millions of nerve bundles in our body and synapses that talk to one another and transmit information to the motor parts of our body and other parts of our body for sensation, everything. What happens with MS, it's an autoimmune disease again. So these antibodies start destroying the lining of the nerve, like the covering, the nerve sheath, so that it becomes destroyed, and then it goes away, and then this nerve is broken and it doesn't work anymore. So wherever that communication went, that area is not going to work. So that's why a lot of people with MS end up having numbness, tingling, difficulty walking, etc. So one of the first symptoms, these people have numbness and tingling. There's something called the Larimet sign, where you put your chin to your chest and you have like this huge tingling wrapped, like you feel like there's a belt around your waist. But numbness, tingling is common. Weakness, ataxia, where they just have difficulty walking, are very common. Also, visual issues. Most commonly optic neuritis, where you have issues behind the eye, the eye nerve, and so it's more like a dimming effect. So there's two different kinds of MS. Oh, actually there's like 3 or 4 different kinds, but let's just say there's the progressive one, and then there's a relapsing one, which is like relapsing remitting, it's called. So this comes and goes, so their life can be like this, and then they get an exacerbation, goes back down. Maybe they have some permanent damage from it, have an exacerbation, maybe they're here for a while and go back down. That's relapsing remitting. The prognosis for debilitation, severe, is a lot less with relapsing remitting than it would be here. This is progressive, so things are progressively getting worse to where these people are wheelchair bound, and but their mind's still intact. That's what's the hard thing. So, but it just depends. So with these people, you have to watch for visual issues, motor impairment, paresthesias, and exacerbations. So my sister has this. She has relapsing remitting. She goes for MRIs every 6 months to make sure there's no new lesions. But a lot of times, now lesions meaning destruction or plaque, or they call it lesions, in the areas of her brain and spinal cord. So she always has lesions, but we want to make sure there's no new lesions. So she does have a baseline with chronic numbness and tingling, but she will have exacerbations, like she ends up with optic neuritis sometimes. So then she has to go on prednisone to help reduce that. And some people can end up blind. But many times, if you give the right medications, such as steroids, that can help. But remember, steroids, the side effects for that. Remember, there's short-term and long-term side effects, long-term Cushing's disease. Also watch blood sugars and that kind of stuff. So she's also had some issues with extreme fatigue, and just like feeling like her legs are just so heavy, like they just hurt, and her muscles hurt. She's just tired, but she just keeps plugging along. It's a very complicated disease, and these people need to be on medications too for MS that's specific for this type of nerve disorder. So there's many out there, Avonex, Rebif. There's tons of new ones now, and I don't even know the names of them, but there's new ones that actually can cause a brain infection, and so you have to be tested to see if you're a carrier of the specific gene that can cause this brain infection. But if you don't, then it's a really good medication to help prevent these exacerbations and increase your quality of life. I have another friend with MS that has more the progressive, like this, a combination of. So she's had a really hard time. She's more where she's been in a wheelchair. She's been in the hospital quite a few times. Men have more issues than women. Men are more commonly have the progressive and decline pretty quickly with that. But anyways, my sister lives a normal life. whereas some people don't live a normal life, and we just hope that she will live a normal life as she keeps getting older. Usually diagnosed in your 20s, but some people can be diagnosed later in life. This is a diagnosis of exclusion. So you can have, like my sister was worked up for probably at least a year or two. There's some people that are worked up for 5 years and no one's ever told them they have MS. They do anything from the scans, a lumbar puncture, and all sorts of lab tests, but it is a diagnosis of exclusion, just to let you know. Okay, that's MS.